All right, we are going to go ahead and get started. We are about 2 minutes behind schedule. It is 4:02. Going to call this meeting to order. First of all, let's begin with roll call. It appears we are missing Member O'Neill, and that would be all. We have Member Farley, Member Tompkins, Member Bell, Member Hanson, and myself. We have a quorum. Do we have any appearances by members of the public or county employees?
We've had no requests this evening.
All right, thank you. I'd like to welcome YWCA CEO Liz German to Health Committee. We're going to start to bring in social service agencies to share all the wonderful things that are going on in our community. And one of the biggest assets that we have is a program called Stepping Stones. Could you tell us a little bit about that, please?
Sure. You want me to turn the microphone? Okay. So thanks for having me, everybody. Like Corey said, my name's Liz German. I'm with YWCA, and we have a variety of programs. One of them is Stepping Stones. So Stepping Stones is the sexual violence crisis program for McLean County in the state of Illinois. Each county gets a contract with a provider that provides this service, and so we hold that contract for McLean County. With Stepping Stones, we provide counseling and advocacy to survivors and victims of sexual assault and abuse, as well as their loved ones. And we also do a lot of prevention education. There's some additional things that we do as being part of a sexual violence crisis center, and that would be working with the hospitals, working with the police departments. So I have a few numbers I just wanted to share with you all, and then I'll update you a little bit about our expansion that was recently 95% complete. So this past fiscal year, which ended June 30th, we had 270 counseling and advocacy clients. And so counseling, you probably have an idea of what that looks like, but advocacy can be anything from medical advocacy, walking along somebody with like a medical process, making sure they don't get bills, if there's follow-up care needed from their assault or abuse, making sure they have those services. And then legal advocacy, obviously, if the courts do decide to go through the criminal justice system, or if a civil case is involved, we can walk alongside survivors with that. Sometimes advocacy is basic needs support. So, for example, if somebody is assaulted in their apartment or their home and they need a different place to stay temporarily, we have some funds available to set somebody up in a different place so that they feel safe and they can have that security. If somebody needs to get out of a lease because they're in an unsafe situation, we can help navigate the laws and the circumstances around that as well. So advocacy kind of, it goes hand in hand with counseling, but it could be that somebody's coming to us for just one thing, or they could be coming to us for several of those things. And when I mention loved ones, our services extend to family members, friends, significant others. So if somebody that you have an intimate relationship with has experienced this and you need resources on how to help them handle it and how to be, a positive friend, husband, partner, whatever, we can also do counseling. We do family counseling, couples counseling, anything if it's related to that sexual assault or abuse incident. We serve ages 3 and up. That's something that a lot of people aren't aware of, unfortunately. A couple years ago, children under 18 were a third of our clients. So that, unfortunately, those clients are out there, but fortunately they are getting the resource and the assistance that they need. So last year, we had 270 counseling and advocacy clients. We had 214 what we call non-client occurrences, which are either somebody calling our hotline and talking with somebody on the hotline, or like a walk-in crisis, and then they decide not to get continuous counseling or support. And so our hotline is 24/7. We have formally trained volunteers, paid volunteers on that hotline, as well as staff as a backup. So you can always call if you have a need for that. And then hospital calls, we had 90. And so the way that plays out is both hospitals, we do have an MOU with both, and they're required to call us if somebody discloses assault or abuse. We come in, we explain their rights in the process. If they want us to stay, we stay. If they don't want us to stay, we leave information and we go. We're there for whatever they want, but the hospitals are required to have us come in so that we can make sure that those folks have all the information they need if they need resources in the future. And then in terms of education and prevention education, we were in 20 elementary schools last fiscal year, mostly teaching Aaron's Law, which is a state requirement. We were in 8 junior high and high schools, and we were at Illinois Wesleyan and Illinois State University. With the junior high, high school, and college crowds, we're mostly doing curriculum around healthy relationships. So what's appropriate, what's not, boundaries, hopefully things that prevent relationships from being violent or abusive. We recently added 2 of those 6 educators that we have last year due to a federal grant with the Office of Violence Against Women, and that's in partnership with Project Oz, and those 2 educators are specifically focusing on the junior high, high school, college demographic, really looking at the relationship piece. So that's kind of stepping stones in a nutshell. We have 16 staff. When I started in 2007, we had 3. So it has grown. The need has grown, the services have grown, and we are lucky that we can, provide 24/7 services. Recently, as some of you probably have heard, we completed an expansion in the building, taking unused space in old locker rooms and adding counseling spaces and basically reconfiguring the whole first section of our lower level. So we went from 4 to 8 counseling rooms, we increased the soundproofing, and we created a setup that has now a private waiting room with a restroom. So everybody who's going into 2 Stepping Stones is encompassed in this kind of protective bubble, so we don't have clients that are maybe at the front desk where other programs and staff are coming in and out. And so it was a $1.5 million project that we are about almost done, a few little checklist, punch list things to do, but they're in the new space and working as of about 3 weeks ago. So very fortunate for the support that the local community, local donors, state dollars, federal dollars, all of it came together to allow us to do the expansion. So, any questions?
Well, thank you again so much for coming in and visiting. I know I went out and saw right before that expansion began work, so I'm sure y'all are very excited to be in a new space and have some privacy.
Yes.
Any other big projects that are coming down the pipe, or any like kind of one-off things? This is kind of an overview of the day-to-day things that are done, and it's certainly a very, very broad spectrum. Are there any special projects that you're working on that you're excited about?
Nothing specifically comes to mind aside from the fact that, we are every year focusing on, in April, Sexual Assault Awareness Month. And I think through the expansion, we've really been able to garner a lot of awareness about the services. And so we want to keep that momentum going. So we are trying to find ways to, when you're in the news because you got some grant or something, then people learn about the services. So we're trying to find ways to keep that momentum up. We are very excited at the increase we've had with the school districts, and so we'll, hopefully keep that going. Stepping Stones is taking a little break from any construction. Well, YW in general is taking a little break from construction right now, but we have a trivia fundraiser coming up, and we will be doing walkthroughs of the space, so we'll be sharing that with everybody if you do want to kind of take a look at the space. Trying to do it in off hours when clients aren't around. So other than that, it's just 24/7 doing what we do.
For sure, for sure. Well, thank you all, and thank you to your staff for all the wonderful work that you do. Any questions, comments? Oh. Yes, Mr. Taylor.
Ms. German, thank you for coming. I know last year the Mental Health and Public Safety Fund provided some funding to assist when you had grants that did not come through. So I'm very pleased to hear that you had a construction grant that you were able to receive. So that's great news. My question to you is, at that time you had staffing shortages, and we're looking at, I think there were what would you call it, when people were not able to receive counseling right away, you had a waiting list. Waiting
yes.
list, that's the phrase
Yeah.
I'm trying to think of.
Yes.
A waiting list for services, and so has that resolved itself?
It has, yeah. I think when we came to the Behavioral Health Committee, we had a waiting list of about 65 clients, And that was due to VOCA and VAWA federal dollars had drastically dropped off. And so we were able to get that funding. We added another counselor. Every once in a while, we'll have a little bit of a waiting list, just if timing, if like we have a staff member leave and we're training a new person or something like that. But we have not had that 65 again since. I think we have like 3 on the waiting list right now, and they're being placed. So they're just on the waiting list for like a week. But that does, it brings up a good point that that's something at the federal level we're watching. Luckily, the state came in at the end of last fiscal year, right before the new budget year, and allocated an additional $20 million to sexual violence crisis centers. And that is what stabilized us long-term. Otherwise, you probably would have seen us again saying we have this big hundreds of thousands of dollars gap. But our state funding basically doubled. The state took on the deficit that the federal drop created. So just took them a little bit. Yeah. Mm-hmm.
Ms. Sherman, thank you again so much. Don't be
Thank
a
you.
stranger. Come on by anytime.
Yeah,
Looking
I was
forward to
gonna
hearing
say.
about what happens going forward.
Sounds good. Thank you.
All right, thank you. Moving forward, we have the consent agenda. We have approval of minutes from the July 8th regular meeting and unpaid bills in the amount of $337,774.81. Can I have a motion? Motion by Hanson, second by Bell. Discussion? Those in favor?
Aye.
Those opposed? Consent agenda passes. Departmental matters, moving to Jessica McKnight of the Health Department. We have no items for action. Director McKnight, can you share any updates with us?
Yeah, you do have my report, and it is including the second quarter updates from our divisions at the Health Department. And I did want to highlight, I know in our Community Health Services division, she talks a little bit about the student nurses. We have been working really hard to get more students into the Health Department to learn more about public health careers. And happy to say that we've had 5 students this summer in different areas. So environmental health, the student nurses that we talked about, and health promotion. So it's been really exciting to have more students coming through and just learning about what we do, and hopefully maybe choosing a career in public health.
When you say students, are you talking about college students, those who have not prospective or potentially decided on a career, or are we looking at high school students as well?
Currently looking at college students, but we've also been talking with Illinois Department of Public Health about potential programs that might also work with high school age or even middle school.
Okay, all right, excellent, very cool. Any questions for Director McKnight? All right, thank you very much for that. Moving on to nursing home, Mr. Wiley. We have one item for action today. Item 5B1A, request to authorize nursing home administrator to offer a salary above that identified in section 5A3 of the 2025 compensation plan. There has been a request to move into closed session. Anybody like to motion to move into closed session? Seeing none, can I have a motion for item 5B1A? So motion by Tompkins, second by Farley. Any discussion? Those in favor?
Aye.
Aye. Those opposed? Motion passes. Mr. Wiley, anything to add?
Just as a point of information, we're also requesting for reclassification of some nurse management positions. And the reason for that reclassification, as you can see in the report, is historically, we've just used floor nurse FTEs to fill the positions in nurse leadership. And we felt like it was important for us to have that designation, for them to have their own pay grade. And then because the pay grade needed to maintain some margin with their supervisors, who would be the assistant directors of nursing, we've requested that reclassification as well. And then as far as the rest of my report, hot off the press today, we received email notification from IDPH that we're clear for temporary occupancy to move residents back into the wing that was phase 1 and start clearing the wing for Phase 2, so that was exciting news. It happened quickly. We thought there would actually be an on-site visit, and we got the email, and I alerted the team, and we're hoping to have the 300 wing cleared by a week from Friday, so Phase 2 can get going.
Excellent. When were you
Having said-
anticipating that change to originally happen?
About this time frame,
Okay.
but the allotted time for IDPH to clear it for temporary occupancy is 45 days, so
Good news indeed.
yes, we were hoping for a quick turnaround like this, but we weren't expecting it, so that was good news for us today.
Excellent. Good to hear.
And then by way of my report, I do want to call attention to the fact that we are watching our finances very closely. As you know, we had to do some census compression to make room for the construction project. Along with that, unfortunately, came a bit of a dip in the market. And for that reason, we're lower in occupancy than where we wanted to be, but we're watching our expenses very closely, and we anticipate an uptick, as I did put in our report. And then related to aging, the committee approved an agreement with, we discussed last month, with our electronic health record and financial software company, and we actually will be initiating their work on our aging this week. So we're excited about that. We anticipate that they'll be able to assist us in cleaning up some of the numbers in the past, and then improve our performance with aging from this day forward. And it'll be a great assistance to our billing specialists, to our business office manager. So I just wanted to update the committee on those items.
Excellent. Thank you very much for that. It's good to hear that things are moving forward. Questions, comments from the committee? All right. Thank you very much, Mr. Wiley. Moving on, I know Mr. Tabb is unable to be here, has no information presented for action. Do we have any information that Mr. Tabb passed on to be shared? You're aware of?
He did not.
Okay, thank you very much. Jail health, Ms. Hughes, Ms. Strum, also no items for action, no other information presented, anything that needed to be shared with us for that?
And no information was provided.
Administrator Taylor, anything to share?
I do not have anything for this committee.
All right, thank you very much. Our next meeting date will be Tuesday, September 2nd at 4:00 p.m. Enjoy the nice weather while we have it, and we are adjourned. Thank you very much.